And I am a family nurse practitioner working at the Coleman Institute for Addiction Medicine. I wanted to talk about the impact of addiction and substance use on the brain and the body. I wanted to first say Happy Valentine's Day to everybody. You know, sometimes we have loved ones and family members in our life that mean a lot to us, and they can struggle with substance use. You know, what are these substances? These substances could be opioids, alcohol, nicotine, food. You know, why do they keep using them? Well, with repeated use of any type of substance, it changes the brain and the way the brain works. And sometimes it can be really hard to stop these substances. So what really takes place in the brain? In our brain, we have dopamine, the pleasure center of the brain. And that area causes us to feel really good when we participate in certain activities, like we engage in these types of substances. And over time, with dopamine shooting up really high, we feel really good using these substances. However, with dopamine shooting up, the brain just gets used to feeling that pleasurable all the time. We also have in our brain the frontal lobe. The frontal lobe is right up here, and that controls our ability to feel our emotions, process certain memories, feel different feelings, and actually heal. However, with repeated substance use and even certain types of food, you know, the brain in that frontal lobe remembers those positive feelings, and it changes over time. So, if you really think about it, it's really hard to stop a substance. And when we do, it takes a long time for the brain to really get back to normal. At least being free of these types of substances for at least 6 months in order to promote some type of change. So, you know, when we recognize that we have a problem with these substances, how do we really stop, and what is the answer? Well, we have to go ahead and be free of the drugs. And depending on how much we're using, you know, we have to go through a comfortable detox in order to get those substances away from the brain. But the brain will continue to transmit signals to the body saying, I need this to feel better, to feel comfort. So as a family member, or even a friend, we have to remember, you know, that people struggling with these substances and using these substances, their brains have changed, and we need to be there for them and understand that it takes a lot of commitment to really be free of these substances and to heal. Thank you.